Bob, behind you. Waving? Yeah, he's been waving at me all day.
Ms. Maddow, thank you for coming to Little Rock. Without going too far past health care, immigration reform is now on screen. What do you think is going to happen, and is it doable in 2010 with the midterm elections coming up?
It's a good question that I don't have a great answer for. My instinct is that this president's going to want to get immigration reform done in a way that he will actually put some political capital behind it. This is not one that the Congress can do alone. The anti-immigration forces are well-funded, vituperative, and willing to do anything in order to stop immigration reform. My sense is that it will not be before November, that there may be something debated between now and November. I don't think you should make decisions on what you can pass based on what your opponents are going to do, but I think that Republicans most want Democrats to take up immigration reform before November because they want to run on that. Everybody keeps saying they're going to run on health. Republicans are going to run on health care in November. If you think about what's going to have actually gone into place between now and November on health reform, that would mean that Republicans are going to be running that they want insurance companies to be able to cut you off your policy when it turns out you get sick. Hell no, we can't. I don't think they're going to run on health care. They would love to run on immigration reform. And so I think that given the environment right now, they will start something. I don't think they will finish something by November, but again, I'm a bad prognosticator and anything could happen. There was a great moment yesterday. Susan and I were in Washington yesterday getting ready to fly here, and the Tea Party protesters were on Capitol Hill. And you know, it's a very small group. There's only a couple hundred people on Capitol Hill yesterday, but it was the smaller the groups get, the angrier they get. And so we had the people with the signs showing the gun, people holding signs showing a gun that said, if Brown can't stop it, meaning if Senator Brown can't stop it, a Browning can, showing a Browning firearm. I mean, it's just, you know, and we also heard racial epithets, homophobic epithets slung at members of Congress. One member of Congress was spat on. I mean, it was very, very ugly. And that was going on the west side of the Capitol. And what also happened yesterday was an immigrant rights demonstration. And so the immigrant rights groups are marching toward the Capitol, toward the Tea Partiers. And I'm thinking, popcorn. And also I'm like, but it was like the Red Sea, you know, like they're terrified of this issue.
You have time for one more.
I'm sorry my answers are so long.
Right there. Right in the middle, right there.
You have a lobby. Can we read the fine print on this question?
Hi.
Hi.
Big fan. So I was declined health insurance for a pre-existing condition of asthma.
I'm sorry.
Yep, it sucked. So how long do you think we're going to be able to actually see the results of the health care bill, and what will the private health insurance companies be able to do to blockade the actual results of the bill?
The implementation of the bill seems relatively straightforward. I mean, what happens in 90 days is that pre-existing conditions will no longer be a cause for excluding people from health coverage for children. That goes into effect in 90 days. For adults, it goes into effect further down the road, and that's a drag. We would hope that that would happen right away. The reason that that is delayed for adults is because the adult pre-existing condition restriction is tied to the exchanges, and the reason is that if you just say we're keeping the private insurance industry, and now you can't exclude anybody because they have a pre-existing condition, then what does everybody do? Everybody drops their health insurance coverage until they get sick, and then they get health insurance in order to get covered, right? So you can't do that unless everybody's required to have health insurance. The mandate is this thing that makes people uncomfortable, but it actually is, it's logic. It actually, you need to have it in order to also mean that people with pre-existing conditions can't be excluded. So the mandate kicks in at the same time that adult pre-existing conditions kick in, which is as much time as they think they need the exchanges to get going, which is a couple of years. So that is in motion, and I think the insurance companies, you know, and the Republicans who are sort of carrying their water on this, and the conservative Democrats are doing the same thing, will do what they can to try to make people afraid of that, but ultimately stories like yours are more compelling than their arguments about their bottom line. And so I think that the implementation issue is pretty rock solid. It's my sense.
Are you sure you have to do your show tonight? Can't we just sit and talk?
I'd love to. I'd love to.
Well, thank you.
I would just say that it was so nice to be asked to be here, and it's so incredibly nice of you all to stay up all night partying so that you could be here for 9 a.m. on a Monday. I really, really, really appreciate you all coming out. It's just so kind, and the reception has been so warm. Thank you. Thank you very much.